No one likes to live with pain, but is ibuprofen killing you? We're going to talk about non-steroidal anti-inflammatories, over-the-counter medicines, what you can do naturally to help pain so that you don't burn out your liver and kidneys. This is Dr. Jason West coming at you with 102 years of healing, and we're going to talk about ibuprofen. Is it killing you? So what is ibuprofen, or is ibuprofen killing you? What are over-the-counter medicines? Are they safe? How does ibuprofen work? This is what this video is about. And after watching the video, you'll understand what ibuprofen is, what does it do, the difference between ibuprofen, aspirin, and non-steroidal anti-inflammatory, and is there a natural way that helps with pain? Now, over-the-counter medicines are drugs you can buy without prescriptions. And some over-the-counter medicines relieve aches, pains, and itches. Some prevent disease like tooth decay and athlete's foot, and others are help manage recurring problems like migraines. And in the United States, the Food and Drug Administration decides whether a medicine is safe enough to sell over the counter, and taking over the counter medicine still has some risk. Some interact with medicines, some interact with supplements, with foods and drinks. Some of those really bother your stomach. They can make it easier to bleed. Others can cause problems with people with certain medical conditions. And if you're pregnant, you absolutely want to talk to your healthcare provider before taking any of those over-the-counter medicines. Now, it's important to take medicines correctly and be careful when giving them to children. More medicines do not necessarily mean better, and you should never take over-the-counter medicines longer or in higher doses than the label recommends. And if your symptoms don't go away, it's a clear message that it's time to see your doctor. Some of the most common over-the-counter medicines include Nicorette gum, Preparation H, No-Dose, aspirin, Extends, Tylenol, Aleve, acetaminophen. So what is ibuprofen? Ibuprofen is a medication in the non-steroidal anti-inflammatory family. It's used for treating pain and fever and inflammation. And this can include things like painful menstrual periods, migraines, rheumatoid arthritis. About 60% of people improve with any given NSAID. Now, NSAIDs have some really neat effects. They also have some unwanted effects, or also side effects. And this includes heartburn, it can have a rash, and compared to other NSAIDs, ibuprofen may have fewer side effects such as gastrointestinal bleeding. It increases the risk of heart failures, kidney failure, and liver failure. Now, at low doses, it does not appear to increase the risk of heart attack. However, at high doses it may, and so ibuprofen can also result in worsened asthma. While it's unclear what it does in early pregnancy, it appears to be harmful in late pregnancy and therefore is not recommended. And like other NSAIDs, it works by inhibiting the production of prostaglandins by decreasing the activity of the enzyme cyclooxygenase. Ibuprofen might be a weaker anti-inflammatory than other non-steroidal anti-inflammatories. It was discovered in 1961 by Stuart Adams and John Nicholson and was marketed as Brufen. Now, it's available under the trade names including Advil and Motrin. It was first marketed in 1969 in the United Kingdoms and the United States in 1974, and it's on the World Health Organization's list of essential medicines. What is the difference between ibuprofen, aspirin, and other non-steroidal anti-inflammatories? Aspirin's really rough on your GI system. It's really not safe for kids. Ibuprofen is less hard on the system. Naproxen is an anti-inflammatory, most used for arthritis, and Tylenol typically is used for headaches, not specifically for arthritis. So when we talk about some alternatives to non-steroidal anti-inflammatory, you can do things like this. My favorite thing to recommend for pain management for migraines and arthritis, believe it or not, is really simple, and that's water. People that don't get enough water are like the Tin Man on the Wizard of Oz. They don't have enough oil, and oil is your water. If you decrease sugar and decrease your anti-inflammatory foods, it acts like a natural NSAID without the harm effects on your liver and your kidneys. One of my favorite supplements to recommend for that is curcumin, turmeric, and the magic mineral for pain management is magnesium. The other consideration for chronic pain management or alternatives to Tylenol is a digestive formula. I like using Digestive from Nature's NX. There's some ultimate omega or essential fatty acids. You need about 4,000 to 6,000 milligrams of essential fatty acids. And if you combine essential fatty acids with a proteolytic enzyme or a digestive enzyme, I have found that you can literally mimic aspirin, Tylenol, acetaminophen effects without having the detrimental effects to your liver and your kidneys. Also, about 5,000 units of vitamin D3 in my clinical experience really helps to give an alternative to Tylenol, and high doses of vitamin B are really, really effective. Now, what can you do for people that have chronic pain patterns that you don't want to take in a prescription or you don't want to have a surgical intervention? There's something called regenerative injection therapy where you can actually get the body to heal from abused joints, from bone-on-bone arthritis. In my clinical experience, we've seen amazing outcomes. You can see that on our video blog. It's called The Daily Dose of Vitamin H, and also something called neural therapy. Now, why neural therapy is so important in the considerations of Tylenol alternatives is because your body was a computer and you called up tech support, we said the body isn't working right, it has a chronic pain or a chronic nerve problem or arthritis problem. Tech support may say turn everything off and turn it back on. Well, what neural therapy does is it helps to reboot the system. You can take a little tiny glycolized ester of para-aminobenzoic acid, also known as procaine. If you inject that in the body, the nerves open, close, and reset. It's a very effective way to take care of chronic pain. If we take care of the pain, you may not need a non-steroidal anti-inflammatory. At our very least, we want to help to avoid liver and kidney impact. We just finished a video on ibuprofen and the effects that it has on your body, as well as alternative treatment considerations instead of using ibuprofen. This is Dr. West, and we'll see you tomorrow.